Good morning. I am Jack Vilashini from Gensomine TDC Petaling Jaya. I'm here to explain about Certificate in Nurse Patient Psychology Competency for UKMSHAPE. I think many people assume nursing is only about clinical competency. Clinical skills are absolutely essential, but today's healthcare environment also demands psychological competency. Patients don't only come with physical illness, they come with fear, anxiety, uncertainty, frustration, and sometimes even anger. A technically excellent nurse may still struggle if they don't know how to manage this emotion. Nurse Patient Psychology Competency (NPPC) is about understanding human behavior, emotional intelligence, and therapeutic communication, so nurses can respond appropriately while maintaining professionalism and empathy. Ultimately, healthcare is not only about treating diseases, it is also about caring for people. Trust is built long before medication is administered. Research consistently shows that patients judge their care based on how safe, respected, and understood they feel. In this program, nurses learn psychological techniques to build rapport quickly, using reassuring language, listen actively, and understand different behavioral styles. When patients feel psychologically safe, they become more cooperative, communicate better, and are more likely to follow treatment plans. That creates a better experience for everyone. We cover many real situations that nurses experience every day. For example, anxious patients who constantly ask questions, aggressive patients, withdrawn patients, patients in denial, emotionally overwhelmed, family members, and patients who refuse treatment. Instead of reacting emotionally, nurses learn to understand that what drives this behavior psychologically. When you understand the emotion behind the behavior, your responses becomes much more effective. Emotional intelligence starts with self-awareness. If nurses can recognize their own emotion, first, they are less likely to react impulsively during stressful situations. Then comes empathy, emotional regulation, and social awareness. These skills allow nurses to communicate calmly, explain difficult situations more effectively, reduce misunderstanding, and manage emotionally charged conversations with patients and their families. Sometimes people don't remember every word we say, but they always remember how we made them feel. This program is very practical. Participants will learn de-escalation techniques, therapeutic communication, and active listening, emotional validation, positive language strategies, and behavioral matching. For example, instead of telling a frightened patient to calm down, nurses learn how to acknowledge the patient's emotion first before guiding them towards cooperation. Small changes in communication can completely change the outcome of an interaction. Nurses experience tremendous emotional pressure every day. Many suppress their emotions simply because they have to continue caring for patients. In this program, We focus on emotional self-awareness, identifying personal emotional triggers, healthy coping strategies, and practical emotional regulation techniques. Emotionally, healthy nurses are better able to care for others without becoming emotionally exhausted themselves. Positive psychology is not about pretending everything is positive. It is about helping people function at their best, even during difficult situations. When combined with therapeutic communication, nurses can create hope, build confidence, reduce patient anxiety, and strengthen the therapeutic relationship. Patients who feel emotionally supported often become more engaged in their own recovery, and that contributes to a much better overall healthcare experience. This program applies positive psychology principle directly to patient interaction and communications. Burnout does not happen overnight. It develops gradually through emotional exhaustion, compassion fatigue, or prolonged stress. We introduce evidence-based strategies from positive psychology, resilience building technique, healthy coping mechanism, and well-being. Well-being monitoring using psychometric assessment. The goal is to help nurses remain compassionate without sacrificing their own mental well-being. Taking care of yourself is not selfish. It is part of providing quality patient care. This is definitely not a program where participants sit and listen for 6 days. Participants will complete 4 validated psychometric assessments and engage in behavioral simulation role play, real as hospital case studies, case discussions, group activities, and scenario-based learning. Everything is designed so that participants can immediately apply what they learn when they return to their workplace. We want learning to become a behavior, not just knowledge. This program combines psychometric assessments, simulations, role play, case-based learning, and scenario-driven practice to ensure that participants can apply the concepts in clinical settings. Hospitals invest significantly in clinical training, and rightly so. However, many patient complaints are not about clinical skills. They are about communication, attitude, empathy, and how the patient treats emotionally. This certification fills that gap. It develops emotionally competent nurses who communicate more effectively, manage challenging situations confidently, and contribute to higher patient satisfaction while reducing burnout. For healthcare organizations, it is an investment in both patient outcome and a trained workforce. For individual nurses, it is an opportunity for future-proof their professional competency. Those interested in joining in the next intake may contact us through our registration channels. We would be happy to share the program details and guide participants through the enrollment process. Jom masuk UKM.